Every single minute, one American dies from heart disease. Just think about that for a second, one every 60 seconds. It's staggering, really.
It truly is an urgent reality.
Absolutely. And it highlights just how widespread this is.
Yeah.
So we have to ask, do you truly know your heart disease risk? And maybe more importantly, do you know what you can actually do about it?
That's the critical question.
Today, we're taking a deep dive into exactly that. We're pulling some powerful insights from our sources, specifically a really fascinating book called Take Control of Your Heart Disease Risk by John Whyte.
Very timely read.
Our mission today is pretty clear. A lot of people, maybe mistakenly, believe they aren't really at risk for heart disease. They might think, oh, it's just family history, or I'm too young, or maybe I feel fine, so what's the worry?
Right, that common misconception.
We're going to unpack why that mindset really needs to change, fundamentally, and give you actionable, practical insights to, empower you to take control of your heart health, moving way beyond just what happens at the doctor's office.
And this dive is just so crucial. I mean, despite heart attacks still being the #1 killer in the U.S. and contributing to nearly 20 million deaths globally each year.
20 million.
Wow. Yeah, there's still this significant, almost alarming lack of awareness about personal risks. We'll explore some surprising connections today and some very practical strategies.
Good. Consider
this. Projections show over 40% of Americans having some form of heart disease by 2030.
40%.
And it's estimated that 2 out of 3 men and 1 out of 2 women will develop it in their lifetime. These aren't just numbers. These are the odds we're actually facing. The stakes couldn't be higher.
Okay, so let's start with something many of us might overlook. We often think about heart health in very physical terms, right?
Yeah.
Diet, exercise, maybe cholesterol numbers.
The usual suspects.
But the sources reveal this incredibly deep and often surprising connection between our emotional health and our heart. It's like way more than just a poetic metaphor.
Oh, absolutely. That's such a powerful insight. Study after study demonstrates that emotions like anger, chronic stress, depression, even things like loneliness and anxiety, they don't just feel bad.
Right.
They cause real biochemical changes in our bodies. These changes translate directly to physiological alterations in our heart.
Actual physical changes.
Yes, think about it. Chronic stress influences how well our blood vessels clot. Overwhelming depression can literally alter the very shape of our hearts. It's really striking how many people see this impact in others, but kind of ignore it in themselves,
Yeah, that makes sense. So when someone is experiencing these strong emotions, how does it actually play out in the body? Like, what are the mechanisms?
Okay, so we see several distinct pathways. For example, people who are depressed often have consistently higher levels of inflammatory markers, like C-reactive protein or CRP.
CRP, yeah, I've heard of that.
Right. It's not just a number on a test. It's a potent indicator of inflammation, and it's strongly associated with a higher risk of developing heart disease. One significant study followed thousands of adults and found this really clear link. Another critical mechanism involves something called endothelial dysfunction. The endothelium, it's that thin, kind of delicate membrane lining your heart and arteries.
Okay.
Its job is to help your blood vessels dilate and constrict smoothly. When it malfunctions, maybe due to depression or mental distress, it directly impacts the artery's ability to open up properly.
It causes problems.
Yeah, it can lead to chest pain and can even be an early sign that plaque is starting to develop. Research has shown this effect can happen even in otherwise healthy young adults.
Wow.
Yeah.
And it gets really profound when we look at platelets, right? Those tiny cells involved in clotting.
Absolutely. Research, including studies going back over 2 decades now, consistently links depression to abnormal platelet activation.
What does that mean, abnormal activation?
It means the platelets become stickier. They're more prone to clumping together. And this stickiness isn't just about forming clots, though that's part of it.
Yeah, okay.
It actually allows those bad LDL cholesterol particles to cross more easily into the artery walls. And that sort of kicks off the whole process of plaque formation, blockages, leading directly to heart attacks and strokes.
The risk to your heart from unmanaged depression is, well, it's very real.
And then there's the heart's rhythm itself. And a term many of our listeners might know from their smartwatches or fitness trackers, heart rate variability, HRV.
Yes. This raises a really vital question. What does your HRV look like? A high degree of heart rate variability, meaning, healthy fluctuations in the time between heartbeats.
The variability.
That indicates a healthy, adaptable body. It can respond appropriately to both branches of your nervous system, the fight or flight and the rest and digest.
Conversely, low HRV, where one branch of your nervous system tends to dominate, that's a common sign of poor cardiac function. It's significantly decreased in people with severe coronary artery disease or heart failure.
How significant?
Well, one major study found that people with the lowest HRV were actually 5 times more likely to die during the study period than those with the highest HRV.
5 times. Wow. That's a compelling reason to pay attention to what your wearables might be telling you.
Definitely.
Before we move on from emotions, the sources also mention a very specific, it's rare, but truly fascinating condition directly tied to overwhelming emotional stress.
Ah, yes, you're talking about broken heart syndrome, or the medical term Takotsubo cardiomyopathy.
Takotsubo. Interesting name.
Yeah, it was first described in Japan. It got its nickname because the heart temporarily balloons out, taking on the shape of an octopus trapping pot used there.
No kidding.
Yeah. And while it typically affects only about 2% of people presenting with heart attack symptoms, its prevalence seems to be rising, particularly among older women. It's just a stark physical manifestation of how profoundly our emotions can impact our physical heart.
It really illustrates that connection powerfully. But the good news here is that there are concrete lifestyle changes that can help relieve depression and, in doing so, powerfully protect your heart.
Indeed, and they're quite practical. Things like avoiding alcohol, smoking, and recreational drugs. Heavy drinkers, for instance, are 4 times more likely to develop depression.
4 times.
Yeah. And don't underestimate the power of a good laugh. Studies show it releases serotonin and other feel-good hormones that genuinely change your mood.
Okay.
Meditating is another powerful tool. Meta-analyses consistently find it improves depression in both seniors and young adults. Getting plenty of sleep is also critical. Research shows that alleviating insomnia significantly reduces depression risk.
Sleep is huge.
It really is. And even something called forest bathing, just spending 20 minutes a day, a few times a week, out in nature can profoundly improve your mood. These aren't just, feel-good suggestions. They're backed by solid science.
That leads us very naturally into stress, which, let's face it, is a universal experience. So beyond emotional distress leading to depression, what does that chronic everyday stress actually do to your heart?
Right. So when your body perceives stress, your brain activates the hypothalamus. This then revs up your sympathetic nervous system. That's your fight or flight response.
Okay.
This triggers a surge of hormones like cortisol and catecholamines, things like adrenaline and noradrenaline.
The stress hormones.
Exactly. These hormones spike your blood pressure by constricting blood vessels. They make arteries less elastic, and they reduce vital blood and oxygen flow to the heart. Over time, this can lead to chest pain, angina, or even heart failure.
Wow.
And consistently high blood pressure from chronic stress can also directly trigger strokes.
So it's not just the direct hit on your heart and vessels, it's like a double whammy, right? It impacts other systems too.
Precisely. Chronic stress also indirectly impacts heart health by messing with your blood sugar. Sometimes it can lead to the development of type 2 diabetes.
And diabetes is a big risk factor itself.
A huge risk factor. A recent large-scale study, nearly 1 million adults, found diabetes was associated with an 18% increase in heart-related mortality.
18%.
Yeah. And we also learned about the particular stress on caregivers. One study found that women spending at least 9 hours a week caring for a sick spouse were nearly twice as likely to die from cardiovascular disease compared to other women. That's a truly significant burden.
That's heavy. And while chronic, low-level stress is obviously the main culprit we talk about, our sources highlight that even acute, like overwhelming stress, can be dangerous.
That's a really compelling point. Sudden episodes of intense anger or fear can actually increase your risk of heart attacks and strokes for several hours, days, or even weeks afterwards.
Weeks.
Yeah. The source points to a study that found up to a 5-fold increase in cardiovascular disease deaths in Los Angeles shortly after the infamous 1994 Northridge earthquake.
Wow, after the earthquake.
It's just a powerful illustration of how deeply our emotions can affect our physical health in very immediate, tangible ways.
So recognizing stress symptoms, headaches, racing heart, shortness of breath, maybe insomnia, that's the crucial first step. The sources provide a fantastic list of stress busters. What are some of your favorites, things our listeners could maybe implement right away?
Oh, these are genuinely practical. Try taking a break from constant small decisions by routinizing some aspects of your life. Maybe you always have the same thing for breakfast or a set Sunday dinner.
It makes the load off.
Exactly. Connect with others, and I mean real, in-person connections, not just scrolling social media.
Hmm.
The source suggests seeing friends for dinner or lunch at least twice a month.
Good advice.
Petting a dog or cat can be remarkably effective. It releases serotonin and oxytocin, those feel-good hormones, while decreasing stress hormones like cortisol.
Hmm.
Write out a short to-do list, maybe limit it to just 3 things, helps reduce that mental chatter, and crucially, make time to recharge, even if it's just an hour or 2 of doing nothing each week. Just downtime.
Yeah, we all need that.
Absolutely. Laughter and singing also release feel-good hormones, improve your mood. Even decluttering your living space can significantly reduce anxiety for many people.
And the sources dive into gratitude as well, showing how it actually impacts the brain itself.
Yes, this is fascinating. Practicing gratitude can literally help rewire your brain. It can turn down activity in areas associated with hyperarousal, anxiety, and stress.
Which area?
It specifically affects key regions like the nucleus accumbens involved in motivation, the amygdala, which processes emotion, and the vagus nerve, which helps regulate heart rate, brings it down.
Interesting.
The recommendation is simple but powerful. Each week, write down 3 things you're grateful for and why you're grateful for them.
The why is important.
Very important. Setting boundaries, learning to say no sometimes, that also plays a big role in stress reduction. And look, if stress is making it genuinely difficult for you to function in your daily life, seeking professional help is a valid, important, and often life-changing step. Don't hesitate.
Okay, so we've covered these sort of silent threats from our emotional world. Now, how do we actually know our personal risk? Our sources break down the risk factors and the specific assessment tools available.
Yeah, it's vital to understand what puts you at increased risk. First, there are factors you unfortunately can't change, like age risk generally increases from the mid-40s for men, mid-50s for women, though of course heart attacks can happen at any age.
Right.
Family history is another big one. For instance, if your father, brother, or son had heart disease before age 55, or your mother, sister, or daughter before 65, that counts as a significant risk factor.
And the closer the relative.
Exactly. Premature coronary artery disease in a sibling can increase your risk by about 40%. In a parent, it could be 60–75%. It matters.
Okay. And then there are the factors we can change, which is where we really start to take control, right?
Precisely. This is where the power lies. These include obesity, particularly fat stored around the abdomen. A waist circumference over 40 inches for men, or 35 for women, is concerning.
Why the belly fat specifically?
That abdominal fat uniquely stresses the heart and really disrupts metabolism. High blood pressure is another major one. Elevated pressure narrows and stiffens blood vessels. The goal is generally around 120/80.
Okay.
Smoking is incredibly damaging. It promotes plaque buildup, thickens the blood. And critically, vaping is not safer. Research suggests vapors are over 50% more likely to have a heart attack.
Not safer. Good to know.
Definitely not. Then there's poor diet, which we'll get into as food is medicine, and hyperlipidemia, that's the medical term for high cholesterol and triglycerides, also crucial.
Are there others?
Yes, other controllable risk factors include certain medications for other conditions, like some cancer drugs, ADHD meds, even daily NSAIDs like ibuprofen if taken long-term. Anxiety, as we discussed, especially for men developing it in middle age, even sudden or intense exertion, while exercise is good overall, can trigger about 6% of heart attacks, so listening to your body is key.
Right. Don't overdo it suddenly.
Exactly. And 2 chronic conditions, gout and cancer, also increase heart disease risk. A cancer diagnosis, for example, can increase your heart disease risk by about 33%, particularly in that first year after diagnosis.
Okay, knowing all these factors, how can we actually calculate our individual risk? Are there tools we can use?
Absolutely. There are online calculators, like the Framingham Risk Score. It estimates your 10-year risk of having a heart attack or stroke.
Framingham, okay.
Yeah. The source mentions an example, Greg, who used it and found his 10-year risk was 9.5%. These scores are typically categorized. Low is less than 5%, borderline 5 to 7.5%, moderate 7.5 up to about 19.9%, and high is 20% or more.
And you should check it regularly.
Definitely. It's crucial to recalculate your score yearly, especially if you're in the low or moderate categories, just to catch any changes early on.
What about tests we might get at the doctor's office, like during a routine checkup?
Lab tests provide vital information. A lipid panel, for instance, measures your cholesterol and triglycerides. For the bad LDL cholesterol, less than 100 milligrams per deciliter is generally ideal.
Under 100.
Right. For triglycerides, less than 150 is considered normal. And the good news is, recent data suggests you don't always need to be fasting for these tests anymore, which makes it easier.
Oh, that's good to know. How often should you get checked?
The American Heart Association recommends it at least every 4 to 6 years, starting at age 20 for low-risk folks. More often, of course, if you already have heart disease, diabetes, or a family history of high cholesterol.
Okay. Are there other important lab tests?
Yeah, others include homocysteine. It's a common amino acid, and if levels are high, it's been linked to early heart disease, ideally less than 15 micromoles per liter.
Homocysteine. Got it.
Vitamin D is another. Low levels could potentially raise blood pressure, though its direct heart benefits are a bit mixed unless you're actually deficient. And while troponin T is critical for diagnosing an acute heart attack,
Right, in the hospital.
exactly, it's not measured as part of a routine prevention strategy.
Okay. And for those who do have symptoms or concerns, what kind of advanced imaging and diagnostic tests are available then?
Right. These are typically for people already experiencing symptoms, not for general screening. They include stress tests, seeing how your heart responds to physical activity, looking for blood flow changes.
Okay.
A stress echocardiogram is an ultrasound of the heart done during stress, showing how it moves and pumps, revealing areas with poor blood flow or past damage.
More detailed.
Yes. Then there are more invasive procedures like a coronary angiogram or cath, where they go directly into the heart vessels with a catheter, usually done to diagnose after other screenings show issues or after a heart attack.
Right.
And newer non-invasive options are becoming more common, like coronary CT angiography, CTA, which gives detailed pictures of the arteries, and cardiac MRI, which evaluates heart function and structure really well and has the big benefit of using no radiation.
Okay, lots of tools available if needed. Now, a core mindset in the source material, which I love, is food is medicine. This is where it becomes incredibly clear just how profound an impact what you eat has on, well, pretty much every system in your body.
Oh, absolutely. It's not an exaggeration. Thousands of studies confirm that your diet profoundly influences your blood pressure, your heart rate, cholesterol, triglyceride levels, the amount of inflammation in your arteries, your blood sugar, even the fat around your organs.
I like key factors.
All key to heart disease risk. The American Heart Association's 2021 dietary guidelines, put together by leading experts, offer a really straightforward guide that anyone can follow for better heart health.
And one of the core principles emphasized is that the quality of calories often matters far more than just the quantity. Isn't that right?
That's a vital distinction, yeah. 200 calories of broccoli have a vastly different effect on your body than 200 calories of, say, candy.
Makes sense.
Broccoli gives you essential vitamins, powerful antioxidants, filling fiber. It helps keep you full. Candy just spikes your blood sugar and offers virtually no nutrients. So yes, the calories in broccoli are undeniably better for you.
But quantity still matters.
Yes, absolutely. It's important to remember quantity still matters for weight management. Consistently consuming more calories than you burn will lead to excess weight, regardless of where those calories come from. Balance is key.
Okay. So with this food as medicine approach, what are some of the key dietary shifts we should be making? Where should people start?
First, a really critical step is to significantly reduce refined grains. We're talking bagels, pastries, white rice, white bread, the usual suspects.
Light stuff.
Pretty much. Major research shows that just 3 servings a day of whole grain foods can lower coronary heart disease risk by nearly 20% and stroke risk by 12%.
That's significant.
It is. And in stark contrast, studies show people eating 4 or more servings of refined grains daily saw larger increases in waist circumference, blood pressure, and blood sugar over time. It's not just empty calories, it actively disrupts your metabolism.
Okay, cut the refined grains. What next?
Next, embrace plant-based proteins, things like beans, lentils, legumes, nuts. They're packed with protein and heart-healthy fiber and naturally low in saturated fat.
Good stuff.
Yeah. A large meta-analysis found a 10% reduction in heart disease and hypertension and a 13% reduction in obesity among those with the highest legume intake. And for nuts, eating several servings a day was linked to a 15% drop in heart disease risk and a 20% drop in death from heart attack or stroke.
Wow. How many nuts are we talking?
Just remember, a handful of unsalted nuts is generally the goal. Portion control matters there too.
Got it. And fish versus red meat, that's a classic debate when it comes to heart health. What's the verdict?
Fish, especially fatty fish with its omega-3 fatty acids, should absolutely be a central part of your diet, ideally 2 to 3 times a week.
Why fish?
It helps lower inflammation and triglycerides. Major research found large fish consumption led to a 10% reduction in heart disease incidence and a 15% reduction in cardiovascular death.
And part of that is just eating less red meat.
Exactly. A significant part of this benefit comes from that substitution effect. You're replacing less healthy, saturated fat-rich, red, and processed meats with fish. It's a double win.
Okay, and when it comes to fats, it's a big yes to olive oil.
Right.
Without a doubt. Olive oil and other unsaturated fats consistently help lower that bad LDL cholesterol and prevent heart attacks and strokes.
Any studies on that?
Yes. One extensive observational study followed over 90,000 U.S. healthcare professionals for decades. It showed that consuming even just half a tablespoon of olive oil daily was associated with a 19% lower risk of dying over 28 years, including death from cardiovascular disease, cancer, and neurodegenerative disease.
Just half a tablespoon.
Sure.
This is powerful.
It's a simple, powerful swap. Now, what you absolutely need to cut back on, maybe even cut out as much as possible, are ultra-processed foods.
What counts as ultra-processed?
Things like packaged cookies, donuts, frozen pizza, most sugary breakfast cereals, sugary drinks, foods engineered for long shelf life. They tend to lack nutrients and aggressively spike your blood sugar and inflammation.
And the impact?
Studies, including one following over 22,000 people, found that the highest intakes of ultra-processed foods led to a shocking 58% higher risk of dying from cardiovascular disease.
58%. That's a direct hit on your heart health.
A direct hit. Exactly.
And then there are those other white crystals we need to be wary of. Sodium and added sugar.
Yes. Let's start with sodium. The average American consumes about 300-400 milligrams daily. The recommendation is 2,300 milligrams max.
We're way over.
Way over. And most of it comes from processed and restaurant foods, not the salt shaker at home.
Right.
High sodium raises blood pressure by making your body retain more water and making it harder for your kidneys to remove fluid. This makes heart attacks and strokes much more likely. Research showed that those consuming up to 4,700 milligrams daily had a 60% higher likelihood of heart attack or stroke.
Wow. Reducing sodium helps then.
Significantly. Reducing sodium intake can significantly lower blood pressure.
Okay, what about sugar?
Similarly, added sugars, that's sugar beyond the natural sugars you find in fruit and dairy, are a huge problem. The average American consumes something like 17 teaspoons daily. It's incredible. One significant study found that getting 25% or more of your daily calories from added sugar tripled the risk of dying from heart disease. Yeah. And sugary beverages are particularly problematic. One meta-analysis showed every single daily serving increased stroke risk by 13% and heart attack risk by 22%. It's a direct threat to your cardiovascular system. Cut back where you can.
Okay, this next point from the sources is quite provocative. I think it will resonate with a lot of listeners. Sitting is the new smoking.
Yeah.
What does that actually mean for our hearts?
It's a powerful analogy, and honestly, it's backed by some serious data. Physical inactivity is actually the fourth leading risk factor for early death worldwide.
Fourth? Wow.
Yeah, contributing to over 3 million deaths annually. Lack of exercise leads to about 6% of all coronary heart disease deaths globally. And some studies suggest low cardiovascular fitness might actually be more dangerous than smoking itself.
More dangerous than smoking.
It's a sobering thought, but the beauty here is that exercise packs an incredible punch, both directly by making blood vessels more flexible and less sticky, and indirectly by helping prevent conditions like diabetes, obesity, and hypertension.
Give me an example.
Okay, even just 75 minutes of weekly strength training alone lowered risk by 11%. But the combination is where the real magic happens. It's about building a well-rounded routine.
And it's not just about hitting the gym, right? You don't necessarily need fancy equipment.
No, absolutely not. Exercise doesn't have to involve a gym membership or expensive gear. You can use your own body weight, resistance bands, or simply go for a brisk walk.
So consistency is key.
Consistency is truly the key. The advice is, don't let more than 2 days go by without some form of activity. Keep the momentum going.
And what about people who've been sedentary for a long time? Is it too late?
Fantastic news on that front. The sources share a compelling study published in Circulation back in 2018. It showed that a 2-year high-intensity exercise program could actually reverse some of the negative cardiac effects of sedentary aging in middle age.
Reverse them. Ow.
It led to substantial decreases in cardiac stiffness and significant increases in maximal oxygen uptake, basically, how your body uses oxygen. So no, it's definitely not too late to start.
That's really encouraging. The source also tackles all those common barriers to exercise. I'm too old. I have no time.
Yeah.
So what does this all boil down to for us, the listener? when it comes to making movement a priority?
It means recognizing that the benefits of exercise go way beyond just how you look. They're fundamentally about how you feel, how long you live, and the quality of that life.
Right.
Doctors should really be writing exercise prescriptions, not just making vague suggestions like get more exercise.
Prescription, I like that.
Yeah. They outline in the source for a week's exercise schedule, like maybe mixing walking with Pilates, having dedicated weight sessions, more walking along with tips on how to progress. It shows how manageable it can be.
What kind of exercises?
It includes specific bodyweight exercises anyone can do, like the plank, plyo squats, push-ups, wall sits, things you can do at home. The real key is finding something you genuinely enjoy, or at least tolerate well,
Wow.
and can sustain for the long haul. Start slow, maybe, and gradually increase the intensity and volume over time. The power is in that consistency.
Okay, let's turn our attention now to supplements and medications. This can be a really confusing area for people, right? Lots of conflicting information out there. What's the single most important thing listeners need to know here?
Okay, the absolute most critical thing, and I can't emphasize this enough, is to tell your doctor and your pharmacist about any supplements you are taking. Every single one.
Why is that so important?
Because supplements can interact with prescription medications. They can change how much of the drug is in your bloodstream, either too much or too little, and that can cause serious problems, even life-threatening ones.
Okay.
And remember, supplements are not regulated like drugs by the FDA. They don't need to undergo rigorous trials proving they're safe and effective before they're sold. They're only removed from the market if they're later proven to cause harm. The burden of proof is completely different.
So there's no magic pill, and some supplements could even be surprisingly harmful.
That's a crucial point. The idea that vitamins and supplements are automatically harmless just because they're sold over the counter is a dangerous misconception.
Yeah.
Sure. For example, beta-carotene supplementation, for some people, might actually outweigh any potential benefits for cardiovascular disease and cancer prevention, possibly even increasing risk. There's also limited evidence suggesting potential risks from taking excess vitamin A, vitamin E, folic acid, and even vitamin C combined with calcium.
Calcium specifically.
Yes, calcium supplements specifically have been associated in some studies with an increased risk of heart disease. That's different from calcium you get naturally from whole foods, which seems fine. More isn't always better with supplements.
Got it. What about some of the popular ones that might have some heart benefits where the data is maybe a bit more mixed or nuanced?
Right, we certainly see mixed data on several popular ones. Probiotics, the good bacteria, may help lower LDL, increase HDL, and perhaps lower blood pressure slightly. The evidence is still developing.
Okay. Garlic.
Garlic is delicious in food, especially crushed. But studies on garlic supplements haven't consistently confirmed cholesterol-lowering effects, and high doses can interfere with blood thinners, so caution is needed there. Fiber is definitely excellent for cholesterol and blood sugar control. Supplementation can certainly help if your diet isn't providing enough, but food sources are generally best.
Omega-3s, like fish oil.
Omega-3 fatty acids, EPA and DHA, found in fish, do show potential for lowering triglycerides and maybe blood pressure. But, and this is important, very high doses, typically more than 1 gram daily from supplements, may increase the risk of atrial fibrillation and irregular heartbeat in some individuals.
Good to know about the dose. Turmeric.
Turmeric, with its active compound curcumin, has anti-inflammatory properties that may lower heart disease risk, but more robust human studies are needed. Vitamin D is essential for overall health, bone health especially, but its direct heart benefits seem mixed unless you have a documented deficiency.
And magnesium.
Magnesium deficiency has been linked to higher risk of high blood pressure, stroke, and diabetes. There's pretty strong data regarding its positive impact on heart rhythm, so ensuring adequate intake, ideally from food, is important.
Okay, so the bottom line then, when considering supplements for heart health, is?
The bottom line is simple. There are no magic pills or powders that will prevent heart disease on their own, period. From a nutrition standpoint, a healthy, well-balanced diet remains the best, most reliable, and most impactful approach.
And if you think you need a supplement?
If you do have documented deficiencies or specific reasons, absolutely discuss supplementation with your doctor or registered nutritionist. But critically, never take supplements instead of, or even in combination with, your prescribed medications without having that essential conversation with your healthcare provider first. It's just too risky otherwise.
Okay. And what about prescription medications for primary prevention, meaning preventing that first heart attack or stroke. How do they fit into this whole picture?
Right. For primary prevention, medications like aspirin are really a careful balance of risks and benefits. If you're between 40 and 59 and have a 10% or higher 10-year heart disease risk, daily low-dose aspirin may provide a small net benefit.
But not for everyone.
No. For those 60 or older, current guidelines suggest it generally has no net benefit for primary prevention, mainly due to the increased risk of bleeding, which can be serious.
Okay. What about other meds?
Beyond aspirin, medications specifically for diabetes, high cholesterol like statins, and high blood pressure play absolutely critical roles in reducing risk, even if you haven't had a heart event yet. They effectively manage the underlying conditions that strongly contribute to heart problems.
So if you need medication, does that mean lifestyle changes didn't work?
Not at all. That's a really important point. Needing medication doesn't mean lifestyle changes failed or that your efforts are pointless. In fact, it's often the opposite.
How so?
Lifestyle changes, diet, exercise, stress management can often lead to needing lower doses of medication or maybe fewer different types of medications than you might have needed otherwise. It's truly a comprehensive approach. Lifestyle, medical monitoring, and appropriate medication when needed all play a vital and interconnected role in your long-term heart health journey. They work together.
What an incredible deep dive this has been into taking control of your heart health. From that really profound, often overlooked connection between our emotions and our physiology, to the sheer power of food and movement, and the strategic role of medical tools and insights. Wow, we've covered a lot of ground today.
We really have. And the core message, as the source so powerfully emphasizes, is that health happens outside the doctor's office. It really does.
Right.
What you do every single day, what you choose to eat, how you manage stress and depression, how active you are, these are the critical, empowering components to truly reducing your heart disease risk and profoundly improving not just the length, but the quality of your life.
So what does all of this mean for you listening right now?
Well, consider this provocative thought. If you started today, right now, making just one small, consistent change based on what we've discussed.
Just one.
Just one. Whether it's adding a daily walk, mindfully choosing water over that sugary drink you usually have, or practicing one simple stress-busting technique each day, what could your heart health look like a year from now, or even 5 years from now? The power to take control, to make a real difference, is truly in your hands.